Difference between sociopath and psychopath. Welcome back. Today we are diving into the intriguing yet complex world of personality disorders, specifically looking at the differences between sociopaths and psychopaths. You might be surprised to learn that while these terms are often used interchangeably, they actually embody distinct characteristics. First up, let's talk about sociopaths. Sociopathy is often linked to environmental factors like upbringing or trauma. Sociopaths tend to be more impulsive and prone to emotional outbursts. They may form attachments to specific individuals but struggle with maintaining social relationships. Their actions can be erratic and they often find it hard to plan for the long term. On the other hand, we have psychopaths who operate on a different wavelength altogether. Psychopathy is frequently seen as more innate with brain differences that affect emotional regulation. Psychopaths are typically more calculating and strategic. They often manipulate others with a charm that is very unsettling and effective. Unlike sociopaths, they often appear perfectly normal, making it hard to identify their true nature. So, in summary, while both sociopaths and psychopaths exhibit antisocial behaviors, the root causes and manifestations of their actions differ significantly. Understanding these distinctions not only helps in psychology but also in recognizing the signs of everyday interactions. Let's have an overview. While people sometimes use the term sociopath and psychopath interchangeably, these conditions are actually quite different. Sociopaths and psychopaths both display challenging behaviors but differ significantly. Sociopaths tend to be impulsive and struggle to form stable relationships due to their volatile nature, while psychopaths, known for their manipulative tendency, pose dangers due to profound lack of empathy and remorse. Understanding these differences help clarify misconceptions about each mental health condition. The variations between a sociopath and psychopath may not seem clear at first, but the conditions are less similar than you might think. These conditions can lead to harmful behavior, but they are each distinct in a number of ways. Individuals who are sociopaths are often volatile. They are manipulative and have difficulty forming attachments to others. Psychopaths can be a danger to others because of their lack of empathy or remorse. Therapy can help these individuals develop healthier ways of managing relationships. Sociopathy individuals exhibiting sociopathy tend to be highly emotional and frequently experience emotional outbursts or mood swings. While those with sociopathy will engage in harmful behaviors, they typically try to rationalize their behavior in some way. Someone with sociopathy may be impulsive and struggle to keep feelings of rage in check, which can result in violent tendencies. Psychopathy, those with psychopathic tendencies may pretend to care about other people's feelings but are unable to form a real emotional bond. Unlike sociopathy, people with psychopathy experience very little emotion and may present themselves as normal to conceal criminal behavior. Psychopathic behavior can cause someone to be cold and they may have difficulty identifying emotional distress in others. In short, they lack empathy. One of the most common psychopath traits is mimicking the actions of people around them. Since psychopathic individuals can learn from others and mirror their behaviors, they can be very charming and pleasant to interact with. Let's talk about causal differences. Well, experts don't know what exactly causes antisocial personality disorders, but it clearly shows that difference is the causes between sociopathy and psychopathy. These causal differences are some of the most significant variations you'll notice when comparing sociopath and psychopath behavior patterns. Now let's talk about sociopathy. It's likely that genetics play a role in sociopathy, but it's caused by not genes alone. People who show sociopathic behavior have often experienced childhood trauma, such as physical or sexual abuse. Experts believe that certain individuals have a genetic risk for sociopathy and environmental factors could be a trigger for the condition. On the other hand, psychopathy, it's thought that genetics and biology are the primary cause of psychopathy. People who show psychopathic behavior have differences in the structure of their brain that can lead to functional impairments. Someone with psychopathy may have a diminished fear response as well as deformations in a part of the brain known as the amygdala. Now let's talk about the diagnosis differences. Typically, most people who present symptoms of either condition will be evaluated for antisocial personality disorder. During the diagnostic process, a mental health professional may further evaluate someone to differentiate between psychopaths versus sociopaths. Sociopathy, there is no clinical test for sociopathy or antisocial personality disorder. Instead, a professional will consider behaviors and thoughts when making a diagnosis. The term sociopath is frequently used by mental health providers, but it's not considered to be an official diagnosis. Psychopathy has been described as a more severe and violent form of antisocial personality disorder, but it's also not a formal diagnosis. People who show symptoms of psychopathy may be diagnosed with ASPD. A professional may identify someone with ASPD as psychopathic if they have difficulty recognizing facial expressions or have minimum reaction to punishment. Now let's talk about sociopathy and psychopathic treatment options. Well, you'll find clear differences when comparing a sociopath versus psychopath. Both conditions can be very difficult to treat. It's rare for anyone who exhibits sociopathy or psychopathy to be able to see any problems with their own behavior. However, both therapy and medication may be used in treatment. Sociopathy, since those with sociopathy struggle with their emotions, therapists may work with someone to improve emotional regulation. People who exhibit sociopathic behavior struggle with a lack of empathy. But studies suggest that in general, empathy can be developed over time. Mood stabilizers and stimulants can help to control emotional outbursts and impulsiveness. Whereas psychopathy for those with psychopathic treatment is often focused on reducing violence and criminal behaviors. Individuals are more likely to show psychopathic traits in childhood, which means they may start treatment earlier in life. Antipsychotics and mood stabilizers may also be used to reduce aggressive behavior. Well, I hope you liked my video and got a good knowledge the difference between sociopaths and psychopaths. To know more about psychology, don't forget to like, share and subscribe my channel.